Uterine activity means pressure, millimeters of mercury, or kPa. What does kPa stand for? Cyret, kilopascals. Okay, and FHR is in BPM. What is BPM? Beats per minute. Okay, it's the heart rate. It's the fetal heart rate, beats per minute. Okay, so there are two components in this graph. Okay, so this tells us the uterine activity, the strength, the duration of the contractions. Okay, this tells us the fetal heart rate. Okay, so now today we are going to talk about or learn about NST. Okay, so NST we don't see the lower part. Why? Because NST, the full form of NST is non-stress test. Non-stress test means testing the fetus when there is no stress. Means a lady is pregnant, okay, and she's sitting there, no stress at all, and you check the fetal heart rate, the tracing of the fetal heart rate when the pregnant lady is not under stress, any form of stress, whether it is contractions or hypoxia, hypercarbia. These are the various forms of stress that we can give the patient. Okay, so when there is no stress, we take the tracing of the fetal heart rate, and how should it be is the important question. Okay, so why do we do NST? Good or not? So the only way that you can know the fetus, whether the fetus is good or not, is on symptoms. Symptoms. How will you know the fetus is good?
By checking whether the heart rates are normal level.
Symptoms. What is symptom? Symptom is what the patient presents with. So how will the patient tell you? What will the patient tell you which tells us that the fetus is good? क्या बोलेगा? Say she is in her 7th month, 8th month. So will she know that there is a fetus inside? How?
Heaviness, some sort of heaviness and
Heaviness, but okay fine, heaviness, and how will she know that the fetus is alive?
what the movement.
Excellent. So she'll feel the fetal movement. So you will ask whether the baby is moving well or not. So fetal movements, fetal kick count, and all those things is one of the ways. On symptoms, okay, signs. You will feel the fetus, the size of it. Then you will feel the fetal movements, because signs is something that you elicit, and then you will auscultate the fetal heart sounds. Okay, so that is how you know the fetus is fine. And there are other investigations which we will not talk about now. But NST is one investigation which is done to know whether the fetus is good or not. Okay, so let's say for instance you are sitting here. What is your heart rate?
Like 70 to 80.
70, 72. You start running around and come back. What will your heart rate be? It will
Increase.
Okay. Suppose there is some problem with you. So your heart and your CNS and everything. In that case, will the change in the heart rate be to the same extent as when you're normal? Right? So if you're ill, okay, the heart rate changes may not be good because you may not be moving around so much. Okay. So basically when you move around, when you run around, the heart rate increases. So that is the reaction. Okay. The fetus is also alive. So fetus can't run, but what can it do? It can move. Okay. So when the baby is moving, do you think the baby's heart rate, the fetal heart rate will go up?
Yes.
Fetal heart rate will go up. So which means that if you have a baby which is moving and the fetal heart rate suddenly goes up, okay, that means the baby is reacting well, so it's a good baby. Okay. So what is the baseline heart rate, fetal heart rate, normal heart rate? Your heart rate is 72, you said. So what do you think is the fetal heart rate?
90.
But नहीं ज़्यादा है, उससे भी ज़्यादा है. हाँ, so it is above 100. So normally either you say it is 120 to 160. Okay, go back to the logic, the basics, the science of it, and then you won't have to mug it up. You just remember it. You may remember a part of it, but while you're writing it down, putting down on paper, suddenly parts and parts will come up and you get the entire picture. So don't try to mug it up or anything, just remember. I mean, whatever we spoke about was nothing great, not great science, right? Just general thing. Okay, so where we were? So we were at the fetal heart rate, baseline heart rate. So baseline heart rate is slightly more. Okay, why? Why?
So normally smaller beings have a higher heart rate because of higher metabolism.
Smaller beings have a heart rate plus the metabolic rate of the baby. BMR is very high because it's growing, okay, trying to become full. So it's high. And how much high? So these days we say it is 110 to 150 is normal, or 120 to 160 is normal. So if we say the lower limit around 100 to 110 is fine, but better to put a cutoff at around 110 and 150 to 160 at a higher level. Okay, so that is the band here. Okay, so you have a paper with you. So there is a band here. What is the band? Between? The band is between
120 to 160.
120 to 160. Okay. So which means that if you take a tracing and if the entire tracing is along this green band, that means the baby's baseline heart is good. Okay. So first thing is baseline heart. Okay. Now what do we want the baby to do? Move. Okay. So when the baby moves, okay, the heart rate will automatically go up. Okay. So that will be reflected as a small hump on the graph. Okay. So when the baby moves, the hump will be there. But how do we know the baby is moved? The patient will tell us. So you give a button to the patient that whenever she feels or perceives a baby's movement, fetal movement, she presses the button and automatically a small arrow will come out here. So you know that that is the spot where the baby has moved or fetus has moved. Okay. So when you see a corresponding hump in the baseline heart rate along with that mark, you know that that is the reaction to the baby's movement. Okay. So if your baseline is say around 110, 120, okay, and then the baby moves, okay, the heart rate will go up say by around 10, 15 beats. So from 110 it will become 120, 125 or 130. It can sometimes go up to 150 also. That's fine. But at least it should jump up say 15 beats. And then it jumps up, the baby is moving, baby won't just move and stop. So baby will move for some time, 5 seconds, 10 seconds, then it will quiet, will probably go off to sleep also. But the heart rate will persist for some time, some say 15 seconds, 30 seconds. So if with the movement the heart rate goes up, okay, say by 10, 15 beats, 15 beats at least, and is persistent for around 15 to 30 seconds, okay, that means that is a good reaction. That's why, so baby is reacting well. Okay, we are using these terms reacting because it will come to that later. So reacting well, so that is one thing. Okay, then what also happens is that how many times the baby moves. So probably if the baby is asleep, okay, the baby may not move at all. Okay, but in an NST strip, okay, usually we take it for 20 minutes, but ideally if the baby doesn't move in 20 minutes, you take for 40 minutes, and in those 40 minutes there should at least be 2 baby movements or fetal movements. Okay, and then once the baby moves, fetus moves, the reaction to the baby's movements in terms of the fetal heart rate will be recorded. So we have 2 things. One is the baseline. Okay, one is the acceleration. We call that hump as an acceleration in response to the fetal movement. Okay, so these are 3 things. So when the baby's fetal heart rate is say baseline normal, say 110, 120, 130, 140, 150, 160. Okay. Secondly, there are at least 2 fetal movements in a span of 20 to 40 minutes. And if there is an acceleration with the fetal movements of around say 15 beats per minute, lasting for at least 15 to 30 seconds. Okay. These 3 components are there. That means the baby is good and reacting well. So we call this a reactive NST. Okay. So the reactive NST says that the baby is fine. Okay, but if the baby does not show any fetal movements, if with the fetal movement the heart rate doesn't go up, or if the baseline is not very good, it is very high or very low, that means it is a non-reactive NST. Okay, so these are 2 things, reactive NST and non-reactive NST. We also have something called as non-reassuring patterns and all, but then that's not for you. For you it is very simple. You have a reactive NST or a non-reactive NST. So you know the components, the baseline, the fetal movements, and the acceleration to fetal movements in a span of 20 to 40 minutes. Okay. Now, when you are moving around, okay, the demand for oxygen is increased by the organs, so the heart has to pump more. Okay. So how does the body do this? Tell me, you are moving, you are using your muscles, right? So muscles are moving. So the muscles need oxygen. Plus the muscles start secreting lactic acid, so everything has to be thrown out. So that means the muscles need more amount of blood supply. So blood supply has to increase. So blood supply can increase by 2 things. One is that the vessels will dilate, and the second is by increasing the heart rate. So more number of times the heart beats, more number of pushes the blood will and the dilation. Okay. So but what tells the heart to beat faster? Physio. Are there any receptors that you know of? The oxygen levels go down, the carbon dioxide levels go up. This is perceived by some receptors. What are the two types of receptors, CVS? One is pressure receptors, the other is chemical receptors. So what are the two receptors? What are they called?
Pressure and chemical.
Pressure receptor नहीं, वो तो मैंने बोला pressure receptor. बोलो. You people are that of the future.
Baroreceptor.
You are the barometer of the future. So baroreceptors. You have the baroreceptors and the chemoreceptors, right? So baroreceptors are the pressure receptors. Chemoreceptors are the receptors which sense the chemical in the blood. So these will be triggered, and they will send messages, impulses to where? To whom? What's your CPU? Brain. Through nervous pathways. Okay, and then the brain will get those signals, and then the brain will process the signals, and then again send. This was afferent, and the brain will send efferent signals. Okay, to the person to say abhi mat bhag, to the heart to beat faster. Okay, so this afferent efferent pathway for the heart is which part of your nervous system? What types of nervous system में कैसा है distribution?
This is the sympathetic.
Very good. So that is called as sympathetic and parasympathetic is called as what nervous system?
Autonomic.
So autonomous. What do you mean by the term autonomous nervous system? Means it is not controlled by you. So the system, the nervous system which controls the heart is the sympathetic and parasympathetic, which put together is autonomous nervous system, right? So autonomous nervous system means क्या है?
It's not controlled by the body.
It is not under your control, not completely under your control, but there are times when you can control the autonomous nervous system also, but this is autonomous nervous system. Okay, the messages which are being sent up and down the neural pathway, okay, is through the nerves. How are the messages are conducted through the nerves? Conduction of impulses by?
Neurons.
Yeah, neurons. From neuron to
Neuron to neuron.
neuron to neuron. But along the neuron has got a central
Dendron.
two parts क्या है?
Axon and
Axon and
Dendron.
dendron. So along the axon वो कैसे travel करेगा?
Myelin sheath.
Myelin sheath. It will, and is it a continuous thing or it jumps? Jumps on the jumps on the
Nodes.
nodes of
Ganglion.
Ranvier. Okay, so you remember all these things. You keep coming back because suddenly once you are in Gynaec, you realize that if I do anatomy now, I'll crack anatomy. If I do physio now, I'll crack physio. Okay, so it's all going back again. So nodes are coming. So to jump from the nodes of Ranvier, what do you need?
Sheath.
Myelin sheath.
Myelin sheath.
Okay, so myelin sheath is important. So which means that is the myelin sheath there from the very beginning? In the nervous system, it slowly develops. So it takes some time for it to develop. So let's say generally myelin sheath is near complete by around say 28-30 weeks. So if the myelin sheath is not complete at around 26 weeks, will the fetus react in this manner? No. So for the fetus to react in this manner, myelin sheath has to be complete, okay, or near complete. So which means that we will do this NST where?
Beyond which week?
The 28, 26.
Beyond 28 to 30 weeks, and 28 weeks is the period of, it's important, right? 28 weeks is the period of viability, right? We spoke in para-thina. Okay, so although even 24 weeks, 20 weeks fetuses survive, but for India it's still 28 weeks or 26 to 28 weeks. Okay, so we do NST only after 30 weeks. Why? Because we want to know how the baby is. Okay, do we do it in all pregnant women NST?
Yes.
No, we don't do. Because in most of the pregnant women who come to us, we check for the mother's weight, the BP, everything, the history examination part. Then we check the baby, do all the maneuvers and find out if the baby is good size or not. Then we auscultate the heart, we find the baby is fine. If everything is fine, and whatever periodic investigations that need to be done, like ultrasound and all those things, everything is fine, then we don't have to monitor because this is a natural process. We don't have to monitor. But The reason why you are giving antenatal care, where in the first 6 months they come every month, from 6 months to around say 36 weeks they come every fortnight, and from 36 weeks onward they come every week, is because you want to monitor the baby, monitor the mother also. Okay, so anytime you feel that there is some problem, that the baby is not growing too well, or there is a maternal condition like diabetes or hypertension, PIH or something, which might affect the baby, okay, that puts the baby on high risk. So in these babies you need to sort of monitor, okay, a little stringently, okay. So this is called as fetal surveillance. So NST is a part of fetal surveillance during antenatal period, and usually done whenever there is high risk in the mother or the fetus, like intrauterine growth restrictions or any high risk conditions in the mother, or if the mother complains that the baby is not moving too well, okay, or she has had previous losses, lots of things. So whenever there is a high risk, or mother is complaining that the baby is not moving too well, you do an NST. Okay, how frequently do you do an NST? There is no hard and fast rule. Okay, so you can do it say once in a week, okay, or if you think it is very high risk and the baby is not growing too well, twice a week, even alternate day, okay, depending upon how severe is the problem. Okay, so that is how frequently you do the NST. Okay, so this is about NST. Now suppose you pick up a bad NST, okay, or baby is not reacting well, so you call that as a non-reactive NST. Okay, does it mean that the baby is bad? Like you taken 20 minutes, there were no movements, 40 minutes, there were no movements, the baseline was there, okay, but no accelerations. Okay, does that mean that the baby is bad? No, why?
It could also mean the baby is not fully developed, maybe just.
No, we are doing it only after the baby is developed, 30 weeks, myelination done. Oh, very good. The baby is sleeping. The baby sleeps inside. Okay, the baby sleeps for like 50. After delivery, also the baby will sleep for around 16, 18 hours or so. So the baby is sleeping inside. We are not worried. Okay, so that is why when there is a non-reactive NST, it doesn't mean that the baby is bad. But when there is a reactive NST, it means that the baby is good. So that's the reassuring part of your NST, that tells us that the baby is good. Okay, if the NST is not reactive, okay, non-reactive NST, then what will you do?
Again after some time.
Very good. You will try to get the NST done at a point where the baby is moving well. Okay. So for that, what you can do? You call her after some time. Ask her to go take something to eat. When the glucose levels are high, the baby's metabolism will come up. You will start moving. Or you can just move the baby a little bit. Wake up the baby. Arey utho. Okay, or you can give some vibrative stimulus. We have something called as a VAST, VAST, vibrative acoustic stimulating test. Okay, we give a vibration to the baby, maternal abdomen, at a certain frequency for a certain time, and then see the reaction of the baby. But that reaction is not non-stress test, because you are giving the baby the stress of vibration and the acoustic stimulus. But that reaction is called as a VAST test. Okay, so it will tell us the baby will jerk suddenly, and then the heart rate will, suppose you are suddenly woken up in the middle of the night. Okay, what will happen to your heart rate?
Increase.
It will increase to higher extent. It will go beyond the roof, ऐसा, right? So same thing happens in VAST also. Okay, baby's heart rate will go to 110, 120, 130, 140, 160, maybe probably even 180, and will not come down very easily. Will persist there for a long time. So that is the different reaction. So this is what you can do. Suppose NST is persistently non-reactive, okay, then you should be worried, and then probably you should go to the next test, something like an ultrasound or a biophysical profile or a Doppler test. So these are the tests which will be done if you have a persistently non-reactive NST. Okay, so in this NST we have talked about everything except for one small part. Okay, now you are sitting here, you put your hand on your pulse. Okay, your CVS, everything is completely mature. Okay, you are completely formed. Okay, and you are relaxed. Okay, what will your heart rate be? 70, 80, whatever. Okay, persist. After say 15 seconds, what will your heart rate be? Same, probably 1 or 2 beats. So it will remain constant. But the baby is not completely formed. It's still in the process of getting formed. The autonomic nervous system is not completely formed. The cardiovascular system is not completely formed. So what happens to the heart rate is that it goes up and down. So if you take a tracing, your tracing would be a nice flat line, okay, at 70, 80 or whatever. But when you take a baby's tracing, it will not be a flat, it will be juggling. Like this part. Okay, you see up and down. Okay? So that juggling, even if it is not moving, it will be like this. So which means that the time interval between two beats, okay, say beat 1 and beat 2, if it is 0.6 second, beat 2 and beat 3 might be 0.5 seconds, beat 3 and beat 4 might be 0.54 seconds. So between two beats, the time interval will keep on changing. Okay, plus say between 10 beats also, first 10 beats or next 10 beats ka bhi the time interval will change. So this is called as a beat to beat variability of time. So which is a good sign. Okay, actually it's a good sign. Okay, if the beat to beat variability is not there, if it's a flat thing, then there is something wrong with the baby, because a normal pattern should have this beat to beat variability. So there are two things called as a short term beat to beat variability and long term beat to beat variability, but clinical importance not so much, and for you all also it's okay if you don't know about that. So this is beat to beat variability. So what are the things that you check out in a non-stress test? First thing,
What baseline?
second baseline, second एक baseline heart rate, then second movement of the baby, third
Change in the heart rate.
change in the heart rate with the movements, and fourth that we spoke about just now, that is change in the heart rate, and fourth is the beat to beat variability. So these are the four things that